The broadcast is now starting. All attendees are in listen-only mode.
Hello, everyone. Thank you for joining our webinar, Economic Barriers to Childcare, which is being presented by Dominic Modicamore, Labor Economics Lead at ICF. This webinar is being hosted by Peter Evangelakis, Senior Vice President of Economics and Consulting at REMI. At REMI, we provide economic modeling solutions relating to fields such as economic development, equity, transportation, tax, and more. At any time during this presentation, you can ask a question in the question box. And time permitting, Peter will moderate these questions with Dominic after the conclusion of the presentation. Shortly after the presentation concludes, an email will be sent to you that contains the slides and a recording of this presentation, as you can use it as a reference. If you have any questions about these materials, I encourage you to reach out to info@remi.com. Peter, you can go ahead and introduce Dominic.
Thank you very much, Brian. It's my pleasure to introduce Dominic. He's an economist at ICF with 26 years of professional experience. He is a subject matter expert in economic and fiscal impact analysis, labor market analytics, and industry sector analysis. He also has extensive experience measuring program performance by analyzing participant outcomes and conducting cost, ROI, and cost-benefit analysis studies. Mr. Modicamore has conducted numerous economic and fiscal impact analyses, ROI studies, labor market, industry sector, and economic development studies at the national, regional, and local levels. Recent economic impact studies that he has completed include the economic and fiscal impact of the Washington, D.C. food industry cluster, the economic and fiscal impact of childcare accessibility in Washington State, which will be the subject of this presentation, the economic and fiscal impact of refugee resettlement in Colorado, and the economic impact of oil and gas industry in the Gulf Coast. He is a Master's of Urban Planning with a specialization in economic development planning from the State University of New York at Buffalo. I'll say it was a pleasure supporting Dominic as he carried out the study that you'll be seeing. And so it's my pleasure to turn it over to him. Take it away.
Thanks, Peter. So can everybody see my slides?
Yes.
Yeah.
Okay, good. All right, well, thanks for the introduction, Peter. Good afternoon. It's a pleasure to deliver this webinar for REMI. I'll be presenting on an analysis that I did a few years ago on the economic impact of barriers to childcare access in Washington State. So I use the REMI PI Plus model for this analysis. So just a quick overview of the presentation. I'm going to start with presenting the research questions that we're seeking to answer with the analysis. Then I'm going to discuss the approach and methodology that we use for the analysis, including our logic model, data collection, the model input variables that we used, and adjustments that we made to factor in the impacts of the pandemic, because this study was done towards the end of 2019, so it was right when the pandemic started to really shut things down and really have an impact on the economy. So I'll talk about how the adjustments that we made to accommodate that. And then finally, I will end with a discussion on the economic and fiscal impact results of the analysis. So these are the research questions that we developed for the study. So Washington State wanted to know the impact that barriers to child care access for parents in the state have on the state economy and the fiscal implications on tax revenue. So there's a lot of evidence, and they've done a lot of their own research that shows that healthcare is unaffordable in many cases for lower wage workers. Also, there isn't always access to sufficient childcare, particularly in more rural areas of the state, and just the quality. There's also some issues with the reliability of the childcare. So they, based on that research they wanted to know how does this impact the state economy. So to answer these questions, we conducted a literature review and we engaged childcare industry experts at ICF to understand how childcare access impacts households and businesses in Washington State. So what we found was that childcare barriers lead to lost time at work and reduction in labor force participation for households, and lost productivity and greater operating costs for businesses. Based on these findings, we formulated 4 research questions to measure the impact that these barriers have on the economy. So these 4 research questions were: how do the barriers to childcare access impact labor force participation? How do the barriers impact household earnings? How do these barriers impact productivity in the workforce? And how do barriers to childcare access impact business operating costs? So these were the 4 major questions that we wanted to answer and analyze to measure how it impacts the economy in Washington State. So we started off, based on those questions, we developed a logic model to just draw out exactly how childcare access barriers impact the economy. So we developed a logic model that shows the areas of impact that affect households and employers economically. So we use this approach to develop the economic impact analysis. The economic impact analysis estimates the impacts of 3 scenarios that arise when parents face barriers to childcare access. And as I mentioned, these are lost time at work, increased employee turnover, and reduction in labor force participation. So for each of these 3 scenarios, parent and employer impacts were identified and calculated using data from a parent survey, using data from REMI's baseline forecast, and also data from the U.S. Census and the Bureau of Labor Statistics. And I'll talk about those sources in the next slide. The first impact, lost time at work, is comprised of the number of hours and days working parents in Washington State reported having to use unpaid time off to accommodate child care challenges. So this generates losses in household income and also employer productivity. The second impact, increased employee turnover, represents the additional cost in terms of hiring, recruiting, and training that an employer accrues due to higher turnover rates that stem from employees with child care issues, and also lost productivity during the time that it takes to replace these employees. The third impact, a reduction in labor force participation, leads to lost household earnings and lost productivity stemming from 3 scenarios. The first is parents who are not employed, but would be if it wasn't for child care and accessibility. And number 2 are parents who currently work part-time, but would work full-time if child care was an issue. And the third is parents who had their normal working hours reduced due to child care issues. In addition to the impacts to households and employers, the government also experiences losses in tax revenue due to child care barriers. Before tax losses are calculated, the monetary inputs estimated from the 3 impact scenarios are simulated through the REMI model to determine the economic impact. Then the results of that is used to estimate the fiscal impact on the state using the various tax rates in Washington State that were provided by the Department of Revenue. So the impact on state sales tax revenues derived from the change in household purchases on taxable goods and from lost wages as a result of lost time at work and lower labor force participation. The impact on the businesses and they have an occupation tax in Washington State is derived from the change in gross receipts or the value of production, and also from the lower productivity, lost time at work, higher employee turnover, and the lower labor force participation. So as I mentioned, we did some of the primary data collection that we did was a survey of parents in Washington State. So we sent out a survey to several thousand parents. We got 1,500 responses, and these are from parents with children age, from birth to age 12. So the survey asked a number of questions, including the challenges that parents face related to their employment and workforce participation due to child care access barriers. So this is just some of the results from that survey. About half of the job-seeking parents surveyed reported that childcare was not an issue, preventing them from obtaining employment. Another 31% said that reported that they would like part-time employment, but childcare is an issue. Another 16% said they would like full-time employment if childcare wasn't an issue. So roughly 47% of parents with children said that they would work either full or part-time if childcare was an issue. And these parents were not currently working at the time. So the survey respondents also reported other work-related challenges due to childcare issues. A little less than half of the respondents reported that they or their spouse had to take time off due to childcare issues in the past 12 months. A little more than a third reported that they had reduced the number of hours or days worked due to childcare issues. And about 18% reported that in the past 12 months, they had to turn down a job offer or promotion due to childcare issues. So this data was scaled up. The data from the survey, because we had 1,500 or so respondents. There's obviously many more parents with children in the state. So we scaled this the data up to estimate the direct impacts based on the answers to these research or to the survey questions. We also broke the data out by industry and occupation that the parents were working in using a Bureau of Labor Statistics data. And some of the other data sources that we used in addition to the direct data from the survey was data from REMY's control forecast to estimate productivity impacts. As I mentioned, data from on tax rates from the Washington Department of Revenue, and also data from the U.S. Census, the American Community Survey, Bureau of Labor Statistics, Consumer Expenditure Survey. So these were all used to develop the direct impacts that would eventually be inputted into the REMY model. And this shows how we inputted that data into the REMY model. So the data collected from the various sources was inputted into REMI PI Plus model to simulate the impact on the Washington State's economy. So lost wages from lost time at work and the reduction in labor force participation related to child care barriers was modeled using the wage bill variable. The lost productivity from lost time at work from an increase in employee turnover and a reduction in labor force participation was modeled using output without employment, investment, and compensation variable. And the increase in employer cost from an increase in employee turnover related to child care barriers was modeled using the production cost variable in the model. So a lot of data collected. We had to decide how best to model that, to simulate that in the REMI model. So these are the variables that we used. So as I mentioned earlier, this study was started at the very beginning of the pandemic, but by the time we got to this, by the time we got to modeling, to the modeling phase, the economic impact phase, it was towards the end of 2019. So Washington State was concerned that, there were a lot of, there were a lot of people started to work from home at the time. A lot of businesses were closed. So Washington State was concerned about, us modeling this in a forecast that was pre-COVID, a baseline forecast that was pre-COVID. So what we did was we updated, it was a very valid point. So to try to compensate for that change, the sudden change in economic conditions, we updated the U.S. control forecast in the model for 2020, because we were modeling this from 2020, 2021. So we used the updated forecast that reflected projections based on COVID-19. And REMI provided us with the updated forecast based on the University of Michigan RSQE GDE forecast. So we changed the forecast of the model. So 2020 and 2021 were obviously much different control forecast than the previous pre-COVID model. So these next few slides will show the economic impact findings. So this slide shows the economic impact results from the barriers to child care access in Washington State between 2019 and 2028. So just to go back a second, we forecasted out to 2028. We changed 2019 was the base year, but we changed the forecast for 2020 and 2021 based on the new post-COVID forecast. So the impact on employment ranges from 161,300 jobs in 2019 to about 119 or 109,000 jobs in 2028. So these are the way to look at these. They're negatives. So the way to read this is the amount of jobs that the state is not generating because of access to childcare. So gross state product, you can see, ranges from 39 billion to to roughly 31. Output ranges from 64 billion to 50.5 billion, and personal income ranges from almost 17 billion to about 14 billion in 2028. So it's a pretty significant impact. Roughly 100, on average 130,000 jobs a year across the period. And this is this shows the fiscal impact. Business, Washington State is a business and occupation tax that is paid by businesses, and this is the loss that Washington State realizes because of access to child care barriers. And then we also calculated the sales tax. And then we also looked at, Washington State was interested in learning, what impact has the greatest, has the greatest economic impact, like what type of barrier has the greatest type of economic impact. So, we looked at, a few slides ago, we had the 4 major impacts that were in the logic model. So we modeled each one separately to see, to kind of isolate the impacts for each of these to see which ones had the greatest impact. So you can see that labor force participation by far had the greatest impact. Over 50% of the total impact was because of the reduction in labor force participation. The next largest impact was lost time at work. So there was just many hours lost because of child care. That's lost income. It's lost productivity for the businesses. So that was second, and then finally, the employee turnover was the lowest, had the lowest impact, because that's just the businesses just lost productivity because of greater turnover. So those are the impacts. That's all I had. I wanted to leave enough time for questions. So I'll turn it back to you, Peter or Brian.
Excellent. Thank you, Dominic, for the great presentation, and thank you to all who attended. We'll now shortly get into the Q&A portion of the webinar. If you have any questions, I encourage you to enter them now. As I mentioned earlier, soon after the presentation concludes, a link will be sent to your email that contains the slides and a recording from this presentation. If you have any questions about these materials once you receive them, I encourage you to reach out to info@remi.com. And yeah, Peter, you can now take away the question portion.
Wonderful. Thanks, Brian, and thanks, Dominic, for a great presentation. I'll go ahead and encourage folks, if they do have any questions, feel free to type them in the questions box. Don't be shy. But while we're waiting for some, I thought maybe I would take moderator's privilege here and ask 1 or 2 questions. So I guess where I would start is maybe kind of at the beginning of what did when the Washington State came to you, what kind of policy ideas did they have in mind, when they wanted to look at this study? What were some of the options that they were considering?
Yeah, so like I mentioned early on, they had already done a lot of research on their own into the cost of childcare in their state, and looked into how affordable it was, the quality of it, how accessible it was. So they, based on what they found, they knew that they needed to do something to help make childcare more affordable, more accessible to people throughout the state. Whether the cities were pretty well they had childcare. It was not necessarily affordable, but it was there. A lot of the rural areas didn't really have any quality childcare services at all. So they knew that they had to do something. And one of the things is, that they were looking at was to, potentially subsidize the cost. And that wasn't part of the, next step to this could be, at what, how much do we need to subsidize it in order to make it accessible to everybody and affordable. So that would cost the state money, of course, to for that subsidy. So, another interesting study would be, what would factor in the increase in cost to the state to determine the impact that would have. But yeah, I think one of the, some of the policy issues that they were considering, given these results, were subsidizing costs and also encouraging, child care providers to service areas where there were gaps and areas where there were needs.
Great. Getting some feedback here. Okay, great. And I thought I'd ask, we do have some questions coming in, so we'll get to all of those in one moment. I did just want to follow up, has, to your knowledge, has, what's come of this, because this was published in, a very comprehensive study that is available on the Washington State Department of Commerce website. Kind of what has come of this after, has there been, what kind of movement has there been policy-wise, if any, so far?
Well, it's generated a lot of interest and a lot of discussion among the, state government, the various government departments. This was funded by Department of Commerce. A lot of the policy on child care comes out of Health and Human Services, so they've been involved. This study was much larger than just the economic impact piece. I mentioned the survey. That survey was, there was many other questions that were unrelated to, the work, the employment aspects that we needed for the economic impact study. There was also surveys on costs and different types of barriers and things like that. So I think that it's really gained a lot of traction in Washington State, the issue itself. So I'm not sure what policies that have been developed yet, but it has certainly generated a lot of talk, a lot of discussion.
Excellent. So just before we move on to the questions, maybe Brian, if you can be a third party, can you hear us? I do see someone in the chat saying that they can't hear. I want to make sure it's not a systemic issue, and if maybe we can assist the individual if it's just an individual issue.
Yeah, I just sent a message to Link and I saw that message come in. I just encouraged to try reconnecting, but I can hear everything and I think everybody else can as well. It looks like everything is all set.
Okay, excellent. Thank you. Great. Well, then let's move on to some of the questions that have come in. Please, everyone, feel free to continue posting questions in the chat. We do have about half an hour left, so we have pretty robust time here for Q&A. So let's see. The first question here, I think kind of may touch on some of the answer from to my initial questions. But maybe kind of with your thoughts on what would your suggestions be for a remedy or resolution, I guess, I would say some kind of policy prescription. I guess, if you had any based on, what you found in the study.
So recommendations to improve access.
Yeah. Whatever thoughts you might have on that.
Yeah, I think, from the survey that we did, one of the major issues was affordability. For parents that are, have higher wages, they're able to afford childcare, and it isn't so much of an issue with them. Like we saw that 53% said childcare is not an issue. That's made up of people who have like family members taking care of their kids or pay for childcare and they can afford it, and no problems. But that other 47% was made up of the people that had issues, and much of that is affordability. Some of it is like transportation issues. Services may be far away, they can't access them by public transportation and that sort of thing. So there's a variety of issues there, but the number one is affordability. So I think what Washington State was looking at is how can we reduce the cost of childcare. But another issue, and another that makes that difficult is we also found out, because we surveyed childcare workers and we collected wages on them and asked them, about their work experience, and a lot of them say they're underpaid. It's a low paying job, so it's not very attractive to many people because of that. So you do have shortages in the labor market for child care workers too. So that's another issue you've got, which prevents accessibility. If there's a shortage of workers, child care service providers are going to be limited in how many children they can serve based on the number of employees that they can that they have. So you've got this limitation, on the parent side you have, or on the demand side you have high costs. And then on the supply side you got a shortage of labor. So those two coming together is really creating an issue. And if you wanted to subsidize the cost, that there's a few ways I think you can do that. It could be a direct subsidy to parents, or it could be a subsidy to child care providers, so that they can try to fill that gap. But really, it's a difficult situation. I mean, there's a few other approaches. I mean, you could approach it from the private sector, but these are primarily for-profit businesses that provide childcare. I mean, another solution can be, is the public sector willing to really provide the services? I don't know. I'm not, so I'm the economic, so I look at this from an economic perspective. We've got a whole child care team that really looks at those issues and the policies. But those are my thoughts on, at least from an economic standpoint.
Wonderful, thank you. So why don't we move forward? So I think there was maybe at least one of the attendees had a little bit of confusion about one of the slides. If we go back, Dominic, briefly to the slide that had the percentages kind of broken out across the, yeah. So I think my understanding is the way to read this is a kind of row-wise. The percentages should add up kind of row-wise up to 100%.
Yeah, going across the row. So you got like employee turnover. Those are the impacts on employee turnover, and 9% is is what that impact represents of the total. So the 9, the 56, and 35 should be close to 100.
Yeah. So hopefully that clarifies. And then there was another question that I think we can address pretty quickly. There's a question: did you consider that this would be a loss to the economy every year? And yes, that was this was a study done over a 10-year period. I believe you had 2019 through 2028, and so the impacts were put in, the direct effects were put in each year.
Mm-hmm.
So let's see. So why don't we go to the next question here, asking, does the data in Washington State, do you have a sense of whether it looks better or worse as compared to other states, or kind of the national level?
It's on par with what's happening in other states. It tends to be an issue, in every state. Some states, I haven't looked at all the data, but we do quite a bit of work in this area. ICF does. So I could probably ask some colleagues to get their thoughts. But from what I've seen, it seems to be an issue in every state, not particularly worse in Washington. Washington is a higher cost state, so in area, what we did find is we broke the state out into quite a few regions, and the issues that we saw varied across the regions. Like in the Seattle area, some of the biggest barriers were cost. It's expensive. Childcare is expensive in Seattle. You get out to some of the more smaller cities and the rural areas. Costs are less, but wages also less in those areas. So you still had cost issues, but you also had access issues. There's some parts of the state that are very rural, and nearest towns are far away. So in those areas, access and transportation became issues. So, but I think in Washington State, there may be small differences, but I think what we're seeing is it's pretty it's an issue in every state. In some states more so than others, but I think Washington wasn't particularly worse than
Right. Okay. Thank you. Yeah, I know that this is obviously been had kind of a national profile. With earlier iterations of some of the kind of major legislation that was passed in over the last couple of years. I know Washington State has certainly been on the forefront of I think looking at this much more intensively.
There was a study that looked at a number of states. I want to say it was like close to 20. They just seem random states. I'm not sure how they were selected, but I could try to dig that up. But that was another study that was done looking at all those various states. It wasn't as robust as this one. I think they'd use a model, but they try to develop try to estimate the direct impacts. I could try to dig that up and send it to you if anyone's interested.
Wonderful, thank you. So there are a couple of questions here about methodology that I think we can also address fairly straightforwardly. So I'll kind of combine them together. So there's a question about how the loss in productivity was modeled, investment loss. I'm not exactly sure which investment, but loss in productivity, as well as labor force impact. So yeah, here we go. This is perfect. So just as a reminder, here's the slide. So I'll hand it over to you, Dominic.
Yeah, so, based on I could maybe start with the logic model. So we had those three major areas of impact. So, because of various different issues. So you had lost time at work. Parents the survey showed and quantified how much lost time at work parents experienced because of issues they were having with childcare. Lost time at work leads to lost wages and lost productivity for employers. So the second is the employee turnover. So that one that one's related to that. We only factored employer impacts for that. So you had higher employee turnover because we found out from the survey that many parents had to leave. They had an existing job, had a child, and had to leave that job because they couldn't, because of issues with childcare. So you're getting a little more employee turnover. That's costing the employers money in, increase the higher turnover. There's more money spent on training and recruitment and hiring costs. And then again, the lost productivity. Now, the third one was the reduction in labor force participation. So this is just the general. So this is, the number of parents that would work in some capacity, whether it's full-time or part-time, but don't because of issues in childcare. So that leads to just general reduced employment and lost wages because of that. So it's on the employer side, it's lost productivity because they can't, if there's a shortage because of low labor force participation, you've got lost productivity. They just can't produce at their full capacity. And then this impacts the parents in that they're just losing out their foregoing wages because they're not working because of childcare. So we took those and these are the variables that we used to model those. Was that the question?
Yeah. Yeah.
Lost wages. So for all those lost wages, we use the wage bill, which is just a direct, it's a negative number in the wage bill variable, which is just taking wages out of the economy. And then the lost productivity, we used output without employment investment compensation. So what this is, this is saying that a company and industry is losing productivity without losing labor investment compensation. Is that correct, Peter? Maybe you can explain it better.
Yeah, and I should say, there are certain scenarios where, there is a question about the labor force participation variable specifically. That is an option in the model, and that can be used in certain scenarios. Here, I think, kind of based on the type of data that you had, I think this approach made sense just to kind of look at, here's, the labor force participation, less people are working, so kind of going to kind of the heart of the matter of, lost wages, lost production, just based on like that survey data and the way you scaled it up using, these government data sources.
Right.
There are usually a number of ways of attacking it. I think this was a perfectly reasonable approach given the data.
Yeah, what we wanted to do was impact productivity, but not have that impact employment, investment, and compensation, because we weren't losing. These are people that aren't working currently, but they would work if childcare wasn't an issue. So to model the productivity impact,
right,
we had to do it in a way that didn't affect employment, investment, and compensation, because then employment would drop artificially. when it's not actually dropping, it's people that just aren't working currently. That could be.
Right.
So I think that's why we chose to model it that way.
Yeah, absolutely. So let's turn to some other questions. Just maybe a couple of little housekeeping things here. So it looks like there is at least one person interested, Dominic, in that multi-state study that you mentioned. And so, yeah, if you'd like to, you can certainly share it with us, and we can, get it to people who are interested. There is also somebody else who is interested in the full Washington State report. So again, that's something that we can, we can distribute.
Yep. Yeah, I could provide those. I'll send that to you, Peter and Brian. Then you guys can send it to whoever's interested in it.
Absolutely.
Yeah.
We're happy to do that.
Of course.
So then some more questions here. We are getting down to it. We have about 13 minutes left. We have, a handful of questions. Let's see. So do we have, do you know of creative ways that companies are helping employees pay for childcare? Is that something that you or maybe the childcare team had come across in your research?
Yes. The childcare team would definitely be knowledgeable in that. I think they've done employer surveys too around childcare. I could tell you just from experience. I think there's less companies that offer childcare now. I remember my first couple of jobs. I'm pretty sure a company, I didn't utilize it, but I think where I work, they offer childcare, and I don't think they do anymore. There could be companies, and I haven't looked at that research, but just anecdotally, I think there probably are less companies that offer childcare. So that's or at least at a reduced rate. I think normally when they did offer it, I'm sure there's still plenty that do. They offer it it still costs usually, but it's cheaper than you would get in the marketplace, and it's convenient because it's usually in in the office where you work. But yeah, that could be another kind of policy issue to look at. How could employers help with the cost? It's interesting.
Yeah, absolutely. So there's a question about the factors that drive the cost of childcare. For example, I know you discussed shortages of workers. This person is also asking about availability of childcare centers and perhaps impact of state regulations. For example, like maximum number of children per worker, stuff like that. I don't know if you had any more insight into some of those kind of constraining factors over and above what you talked about earlier.
There's constraints on the employers, the service providers themselves. They do need a certain number of staff per child being cared for. So I don't know what the number is, but maybe it's one child care worker for every 5 kids. I think it depends on the age of the kids, but that is certainly a factor, and that's one that it's part of the shortage is related to that. I think these have to be staffed pretty well, and they're regulated in terms of the number of staff depending on how many kids are being cared for. So yeah, that could certainly be part of the labor shortage. Low wages is also part of it. So did that answer the question? Or?
Yeah, I think so. I think that covered it well. Let's see. So there's a question here about, you mentioned certain percentage of those said they didn't have any problems. And I think you mentioned that they kind of fell maybe into two kind of perhaps somewhat overlapping, but somewhat distinct categories of those who maybe had family help or kind of other family and friends help, where maybe they they may or may not be able to afford like paying for childcare, but they have access to to those resources, as well as those who are wealthy enough to be able to pay on the market for childcare.
Yeah. So I mean, I would think more so the former, that a lot of the, because childcare, I mean, there's other, there's often family members will take care of children to allow the parents to go to work, or friends take care of neighbors. It's there's a whole part of it that isn't, that type of childcare doesn't show up in the, in the numbers. It's like we don't, they're not registered child care providers, but they trust each other, and they're, so that's definitely part of that 53% that didn't have an issue. Those were parents that were not, I believe they were parents that were not working. So if they said, "Oh, it's not about childcare," then maybe it's just, that they're just choosing to stay home with their kids, and maybe they're wealthy enough to have childcare, but they'd rather just stay home. So I think that 53% was made up of quite, pretty diverse set of conditions.
Right. Excellent. We have about 7 minutes left. We have just a handful of questions. Let's see. And this, I think we may have touched on some of these issues already, but maybe just it's a good question looking forward. As an economist, what do you think the future looks like for the supply of childcare workers, and are there viable solutions to these shortages?
Yes. I think shortages could be filled if you look at what makes a job attractive. It's it's the type of work that you're doing. There's the compensation that you get. There's the benefits that you get. And I think childcare workers are very low paid compared to other workers with the same skill set in different industries. And we're actually looking into that, comparing skill sets for childcare workers with similar skill sets in other industries to see where they diverge. But I mean, if you look at the requirements, often these registered childcare providers, they do need to have employees that have some sort of credential. There's certain, there's things, there's, for example, like even the, some, medical certifications of some sort, so that they know how to, react if a child needs help. And then there's also some educational requirements that, because often these are preschool type of places, but so it's still kind of an education component to it, which, and those credentials sometimes can be the same as like a kindergarten teacher, for example. And kindergarten teachers make more than childcare workers. So I think a big issue is really, wages. How do we, but wages go up, it could drive costs up. So, we're trying to lower costs and we're trying to increase wages. So, it seems like there's, it's one of those situations where it's, you almost have to subsidize it in some way.
Right. Yeah. It's a challenge on both ends, certainly.
Yeah.
So we have just a couple minutes left. We have a question here. How did you develop the cost estimates? I'm assuming here that that's talking about the maybe cost associated with employee turnover, like that production costs variable that we see on the screen.
Yeah. So that's from your model. That's the baseline forecast.
Mm-hmm.
Right? Is that so? Am I understanding that correctly? So we estimated the direct employer costs associated with turnover. What we looked at,
Right. And what was the data behind that? I guess is maybe the question.
I'll have to look back. So it was data on like turnover rates and the average cost of recruitment, and it was made up of recruitment and a few other things associated with just hiring a person. So it was like, I don't remember the exact source. I could dig it up for you if you want. But it essentially consisted of the cost of just replacing an employee because of increased turnover.
Got it. Mm-hmm. Yeah, that makes sense. So yeah, let's see. That was Kate. If you're interested in further detail, let us know. We're happy to connect you with that information.
Mm-hmm.
And then let's see. There's just a couple more here, and kind of fits well with the time horizon. So we have question here. And is there, do you have a way to estimate the number of, I guess, non-registered childcare providers? I'm assuming probably, like you mentioned before, probably the data is spotty at best.
Yeah, that's a big issue when we do these studies. Is it's very difficult to estimate the number of non-registered. They need to be licensed. These businesses, childcare providers, need to be licensed through the state, and so it's very easy to get the data to get. And the state has various data on each of those licensed providers. There's number of employees. There's how many people they serve. So it's easy that when you're doing this for a state, they could turn over all the administrative data on the registered providers, but it's really just an estimate when it comes to the non-registered. Because there's so many various forms. Like particularly in rural areas, you've got a lot. And there's laws to some states, and even some counties potentially have different laws where you can operate out of, for example, house. It varies so much from state to state that it's very difficult to get good estimates on the number of non-registered.
Right.
Yeah. In this study, they weren't included. They only gave us data for all of the registered child care providers. So we didn't even, that's just one of the limitations.
Yeah, certainly.
But what they also, what they also say is that a lot of those registered ones really are quality. They always mention there's access, there's inaccessibility to affordable, high quality child care. So I think, the high quality Yeah, you may have childcare, but maybe it's not very, because it's not registered and it doesn't have to abide by certain, regulations and have certain laws. It may not be of high quality, so they're excluded because, it isn't, you're still, even though you're using that provider, it's not high quality, as they mentioned, as they term it. So, but yeah, they were
Right.
they were excluded from this.
Right. Yeah. And somebody mentioned like childcare deserts, and I think that can probably, encompass both, just no access at all, or only access to maybe lower quality or non-registered
Right.
child. I certainly, driving around, here, where I live, or when I'm visiting other parts of the country, I will tend to see, kind of thing, small buildings that look like childcare centers. That it's kind of hard to assess what the quality is. Like it could be great, it could be,
Right.
not so great.
Right. Yeah.
Well, I think with that, we're a couple of minutes over. I think we addressed all the questions. I'll turn it back over to Brian in a second. I know we'll be happy to share, the study that was the subject of this presentation, as well as, Dominic will, locate and share with us the multi-state study that he mentioned, and then, we'll be sending out to some of the normal follow-up that Brian mentioned as well. But I wanted to thank Dominic for a great presentation and a very robust Q&A session. And I wanted to thank everybody for joining us today. And I'll give the last word to Brian just for final housekeeping.
Yep. Thank you, everybody. Again, thank you to Dominic for the presentation. As Peter said, you'll shortly be receiving those materials to your email, including the recording from this presentation and slides. And thank you, everybody, for attending, and have a great day.